My name is Tom Ray. I'm the Medical Director for King County Emergency Medical Services and a Professor of Medicine at the University of Washington Medicine. The FACT study is a King County project that's designed to improve outcome for persons who suffer out-of-hospital cardiac arrest. The study will evaluate CPR, including how we do chest compressions and how we do rescue breathing. The study will evaluate approved therapies. What we want to know is which of these approved therapies works best for patients in cardiac arrest. The study will be coordinated by King County Emergency Medical Services in conjunction with UW Medicine. The firefighter EMTs here in King County will be implementing the study. The heart stops pumping blood. The person stops breathing, so the body's deprived of oxygen. The person quickly becomes unconscious, and death will ensue within minutes unless there's emergency actions. And those emergency actions are calling 911, starting CPR with chest compressions, and then if there's available, an automatic external defibrillator, or AED, applied to the chest. When you call 911, the Emergency Communications Center will activate the fire department. They respond immediately, and the firefighter EMTs take over CPR and provide rescue breathing and compressions. They are truly world's experts at CPR. The chest compressions help circulate blood. They're essential as part of CPR. The recommendation is to do the chest compressions at a rate of 100 to 120. We know within that range, actually, there's a bit of variability in how blood flows, how blood circulates. And so what we'd like to do is compare 100 to 110 to 120 and see which of those provides the most life-saving benefit. We will be evaluating two different airway strategies. The first uses a mask that goes over the nose and the mouth, and the firefighter blows air then into the mouth and ultimately into the lungs where there can be oxygen exchange. The second approach is an airway that we actually insert into the back of the mouth. This is a supraglottic airway, and it is more proximal or closer to the windpipe or trachea, and so provides oxygen in a more directed way. Although we do not know which one of these actually provides the best outcome for the patient. We will assign each fire department here in King County with a particular approach, a chest compression rate and an airway strategy. And they will provide that approach for a period of several months. Then they will transition over to the alternate approach. Prior to that transition, they'll go through a retraining so that they maintain their expert skills at CPR. Cardiac arrest is an exceptionally time-sensitive condition. Seconds matter. Life hangs in the balance. We cannot delay. So when the EMT firefighter arrives on scene, they will implement their assigned treatment. This type of study is called exception from consent. We will let the family and the patient know that they've been enrolled in the study as soon as feasible. This type of study is highly regulated and there's lots of oversight. King County has used this type of approach successfully previously to improve cardiac arrest survival. We welcome your input. We love feedback. So there's an opportunity through the website. There's a survey there. We can also, you can provide your contact information and we can get back to you if you have specific questions or comments that aren't covered by the website.